Hello, class. My name is Jung-Jun Lee, and I'm going to discuss the impact of patient awareness and the placebo effect in the field of medicine. In this modern era of medicine and science, where the newest innovative treatments are constantly being created, there exists a fascinating phenomenon that challenges our understanding of medicine, the placebo effect. The placebo effect redefines our traditional notions of how medicine works and highlights the connection between the mind and the body in the healing process. Throughout this presentation, I will explore the question of whether patient awareness affects the efficiency of placebo response in medical treatment by analyzing various academic studies on the patient response differences between open label, which is when patients are revealed which treatments they are receiving, and double blind treatments, which is when patients are unaware which treatment they are receiving. To start, what even is the placebo effect or a placebo? The placebo A placebo is any treatment, including drugs, surgery, psychotherapy, and quack therapy, that is used for a healing effect on a symptom or disease, but that actually is ineffective or is not specifically effective for the condition being treated. The placebo effect curtails the placebo treatment's expectancies that lead to the symptom improvement, and these improvements have physiological correlates that have been supported by recent laboratory experiments. In other words, it's the belief that an effectiveness of a treatment can result in a real improvement in a patient's condition, even if the treatment itself lacks therapeutic qualities. You might have experienced the placebo effect as well. Personally, I remember sleeping much better after drinking traditional Korean medicine made only from the antlers of a deer. Think of a time where you might have experienced the placebo effect. Maybe you remember feeling a boost in energy after taking an expired vitamin, or even some pain relief after receiving a gentle touch or comforting words from loved ones. I'll give you some time to think about it. So, how exactly does belief affect the treatment of a patient? Interestingly, the effective use of a placebo in medicine depends heavily on expectation and belief. There are various interrelated mental processes that contribute to the positive placebo response recorded in medical treatment. According to a study by Schnell and Unger in 2011, the positive placebo responses can be induced by diverse interrelated processes such as behavior conditioning, prior experience of treatment benefit, expectation of a treatment benefit, and social cognition, which is like the context of a treatment. Recent research on open label placebos or placebos administered without deception or concealment suggests that they can be effective in a variety of conditions. The power of belief, expectation, and the context of which treatments are administered can influence our subjective experiences and shape the outcomes of medical treatments. This connection between belief and effective treatment can be attributed to the term perpetual set or a natural tendency for perceptions to be influenced by one's expectations or preconceptions according to Naveed. When patients are aware that they are receiving a placebo, their beliefs and expectations can contribute to positive outcomes. Several studies have demonstrated the efficiency of open label placebo treatments. In 2003, a study conducted by Zimmerman et al. Discovered that the patient's knowledge of taking the placebo may actually have a meaningful effect in addressing various clinical disorders. They found that open label placebos improved allergic symptoms more than treatment as usual, and even more as double blind placebos. But how is it possible that a placebo reported greater success rates over a real treatment backed by scientific evidence. According to Navid, the decision making is often influenced by underlying cognitive biases that hamper our ability to make rational or sound choices. Cognitive biases can shape our beliefs, expectations, and ultimately our treatment outcomes. In this study, the patient's cognitive biases may have played a role in perceiving the effectiveness of the placebo treatment compared to the real treatment. In a study analyzing the effect of open label placebos on sleep in adults with ADHD, researchers found that a greater proportion of patients were good sleepers at the end of the open label extension than at the baseline or at the end of the double blind treatment. These findings provide further evidence that suggests that a patient's awareness of receiving a placebo's treatment can contribute to real and important issues such as ADHD and sleep disorders. These findings also suggest our thought processes and cognitive perceptions can have a profound impact on our physiological well being. This best can be explained as the discriminative stimulus. According to Navid, the discriminative stimulus is a cue that signals reinforcement is available if the subject makes a particular response. In our situation, the patient believes that the reinforcement of the open label placebo's effect, as opposed to the actual medication, will cure their amnesia and sleeping issues. In conclusion, the placebo effect, driven by belief and expectation, has a significant impact on the treatment of medicine. The effective use of placebos depends heavily on the patient's awareness and their mental processes. Recent research on open label placebos administered without deception or concealment suggests that they can be effective in a variety of conditions. Belief heavily affects the treatment of a patient by shaping their perceptions, experiences, and responses. The power of belief and expectations can lead to real improvements in a patient's condition, even if the treatment does not do anything. But in the light of the placebo effect and the potential of an open label placebo, one might wonder, are our beliefs and expectations the missing link to unlocking the full potential of medical treatments? Thank you for listening to my presentation.